America has a drug problem. Every year, billions of dollars worth of unused prescription and over-the-counter medication ends up in the trash, posing a contamination risk to our environment, or worse, creating a hazard to children who might get a hold of the meds, or potentially sustaining someone's substance disorder. Thankfully, nearly 40 states, plus Washington, D.C. and Guam, have implemented drug donation or reuse programs. Though they're not all the same, they regulate and organize the process to make disposing of medicines as seamless as possible. Illinois is one of the latest states to enact a law that puts in place a system through which unused medications can be put to use. State Representative Guzzardi helped craft the bill that would specifically address the high volume of medicine waste generated in institutional settings like hospitals and long-term care settings. He's here with us tonight to tell us more about this effort. Representative Guzzardi, welcome to Amplified. So good to have you here. Now, you co-sponsored the Prescription Drug Repository Program Act that went into effect at the turn of the new year. So tell us about it. How does this work?
Well, thank you so much for having me on. I'm really excited to share with you about this. The bill is about safe, unexpired, unopened prescription drugs. And we want to make sure that those, instead of getting disposed of like they have been in Illinois up to this point, we want to make sure that those can get reused, given to a depository program, and then donated from there to the kind of institutions that serve low-income patients, people who might not be able to afford these drugs otherwise. So we really believe that there are tens of millions of dollars worth of pharmaceuticals every year in the state of Illinois that get thrown in the trash, thrown in an incinerator, and dumped into our waterways that could instead be going to serve low-income patients around the state.
According to the National Conference of State Legislatures, billions of dollars worth of unused medication winds up in the dump every single year. So how does the bill work to remedy that?
Well, so this is a great graphic that you've got here, and it's a great point to make, which is that, we're not talking so much about the amber vials that you might get from CVS or Walgreens, because once those get opened, it's really hard to make sure that the medication is still safe and untampered with. We're really mostly talking about these institutional settings, as you said, the hospitals, the long-term care facilities. They largely get the drugs in blister packs, those big sheets where you pop them out one at a time. So even if you popped out a few of them, you can still make sure that the remainder of the drugs are safe, unexpired, untampered with, right? And so this bill would create a repository program where those unused, unexpired drugs can be donated, and then that repository will coordinate with federally qualified health centers and other free and charitable clinics around the state to learn what drugs those institutions need and create a sort of supply chain to make sure that they get a steady supply of those drugs.
Now, I want to get to the real underbelly here that we haven't talked about yet, which is the outrageous cost of prescription drugs, the difficulty in some communities being able to access them. Now, you've acknowledged that this effort won't be a silver bullet, but it will give many people, specifically those in need, fresh opportunities. And so I would love for you to talk a little bit about the pros that are associated with it and to clear the air about some of the misconceptions about what this might do.
Sure, yeah, I'm glad you brought that up. I mean, we like to say here in Illinois that drugs don't work if people can't afford them. Over the last couple of years with the pandemic and the vaccines, we've seen the incredible breakthroughs that pharmaceutical research can bring to us. But if people can't afford those breakthroughs, then they're no good to anyone. And that's true in so many different areas. I've been legislating the last few years on insulin affordability here in Illinois. I'm sure many of your viewers know somebody who suffers from diabetes and who requires insulin and has seen the cost of that insulin skyrocket over the last 10, 15, 20 years. But it's true for medications of all kinds. The crisis of drug affordability is a tremendous problem in this country. And of course, it hurts historically disadvantaged communities the hardest, right? Folks who are already struggling to make ends meet are forced to make this decision of, do I fill my prescription or do I pay the light bills? Do I keep the heat on when it's cold? We hear, people splitting pills, people skipping doses, taking one every 2 days instead of one every day, just to try to, make ends meet. And that's not a moral healthcare system. That's not the healthcare system that the wealthiest nation in the history of the world ought to be providing to its citizens. So, as you said, this measure that we're discussing today is a piece of the puzzle. It's certainly not going to solve the whole problem of prescription drug affordability, but it will provide a steady stream of drugs instead of going to the incinerator, a steady stream of drugs to those institutions, those healthcare centers who serve our very neediest folks, the folks who are right on the brink, who really do need somewhere to turn to get those drugs to survive.
So this makes complete common sense to me. It just seems reasonable. It seems like people who need access to drugs can get them, right? Why are there so many states that are still holding out on this? What's the resistance to adopting a drug donation program like this? And what are those who are in opposition actually skeptical of?
Well, we had a long road to getting this bill passed here in Illinois. I would say a version of this bill has been introduced in the legislature probably for the past 10 years running or so. There are some tricky questions that you have to answer because, of course, you want to make sure that the drugs that are being donated are safe. You want to make sure that there's a clear chain of custody for those drugs in case there is something wrong with it, that folks are protected. And of course, you want to make sure that the drugs that are getting donated to our low-income neighbors are not sort of second tier or second rate, or maybe they've been on the shelf a little too long. We want to make sure that the folks who get these drugs are getting exactly the same quality of medications as wealthier patients at wealthier institutions. So making sure that chain of custody and the quality of the medications is there, that's a tricky thing. And making sure that every actor who's sort of in the process is accountable toward keeping those drugs safe. That required a little bit of negotiation, but after working on this for quite some time, we were able to get it done. As you said, there's already dozens of states that do this, and I really encourage my colleagues in those states that don't yet have a program like this to make it happen, because the results are going to be really, really vital for our communities in need.
I can't help but just kind of think a little skeptically about the fact that this actually doesn't help the pharmaceutical industry at all. They want to be able to sell drugs, and so what if you throw them out? That means that that's more that you're going to buy from them. And they just recently hiked drug prices in January by 5 to 6% on average. And so you got Congress still debating on how to address prices of drugs. Looks like Americans are going to continue to be stuck paying the price. I wonder if this program in your bill could actually help to bridge that gap and be a step in the right direction in achieving lower drug prices for people who might not otherwise be able to afford them, but ultimately putting a little bit of pressure on the industry itself. Because when we're talking about supply and demand, if we're reusing this, if we're really utilizing the supply, the demand won't be there for them.
No, that's right. And I think you're exactly right to sort of put your finger on this as part of the larger conversation around drug costs in this country. Because, the truth of what's happening in America is that our regulatory institutions, government and regulating agencies, have been completely captured by the pharmaceutical industry, right? The amount of campaign contributions that go from big pharma into not only Congress in Washington, but state legislatures all over the country. My colleagues here in Illinois and all of the other 49 state legislatures around the country, right? They are pumping millions and millions of dollars into the campaign coffers of legislators on both sides of the aisle. And the result is that, we can nibble around the edges, but when we try to really attack the heart of the problem, which is that pharmaceutical companies are profiting off of sick people who rely on their products to survive. When we really try to get at the heart of that problem, that's when the money comes out, that's when the suits come out, and that's when our bills start getting shelved. So I'm really proud that we were able to make this step in the right direction. And I'm the chair of the Prescription Drug Affordability Committee in the Illinois House, and it is our mission to keep making steps toward the goal of bringing these drugs to the folks who need them. Drugs don't work if people can't afford them.
Well, congratulations on the progress that you are making. Illinois State Representative Will Guzzardi, sponsor of the Illinois Drug Reuse Opportunity Program Act. Thanks so much for being here tonight and sharing with us.